G'day, how's it going?
Okay, here we go. So, Lauren, tell us, how did you come to be a chiropractor?
So when I was in primary school, one of my family members went through a very difficult medical issues, or a few difficult medical issues, and I was exposed to the medical field really early on, and fell in love with that, world and the realm of just different medical disciplines. And when I was in high school, then I channeled all my subjects and thinking into doing medical.
So you were originally interested in pursuing the route of becoming a doctor? So
well, doctor, physiotherapist, like I didn't know
medical
which.
related.
Yeah, anything medical related. So right after school, I did a bachelor in medical science, so it was quite broad. And then during that year, I decided to go and career shadow all the different medical disciplines, and I came across chiro, and that was the one that stood out to me.
Oh wow!
And
how did you come across chiro?
So I went and visited a chiro and asked if I could watch him treat, and I just loved the way that he treated the patients and their reactions afterwards.
So you knew nothing about chiro? You just knew that it existed?
Chiro. Yeah.
So you were checking out doctors, physios, whoever else?
OTs,
I've got to go and check a chiro.
Yeah.
And what was it that you liked about this chiropractor? The results that he was he was able to give to his patients.
Yes, and just the reactions.
He was quite a manual therapist.
Yeah, so completely manual chiropractic. And I.
So by manual we mean using your hands to adjust as opposed to any sort of instrument or even a drop piece table.
Yeah. And I just loved the reaction of the patients afterwards and the look on their faces, and
oh wow.
And then I decided to apply for chiro, and I got in straight away.
Wow. So what was the the time difference between when you observed that person and when you applied? Was this in the same year or?
In the same year.
Okay, so you would have been in your late teens or something?
19.
Wow. Okay, cool.
Or 18, 19.
Yep.
Yeah.
And then so you applied
and then when I applied for other medical degrees as backup, as we all do.
Yep.
And all those doors closed, but chiro's doors opened. So my mum always said, don't sweat that. Go with what's, where you're supposed to be going. And I got in straight away. I was told on the interview I got in straight away. So it was meant to be.
Oh, fantastic. And you haven't looked back since?
No.
You've been a chiro ever since?
Chiro ever since.
Awesome.
Yeah.
So you also come from a gymnastics background, correct?
Yes.
Is that how you define yourself, at least within the sporting realm?
Yeah, I think it taught me, it's a very disciplined sport, and it taught me a lot of discipline and determination in my life. And
what gymnastics was it? I mean, that's all encompassing? You did?
Yeah, everything.
Everything.
Started from artistic gymnastics, bar, beam, and then went to tumbling, and then
tumbling, just rolling around on the ground.
Well, no, like doing
somersaults.
All those kind of things down a strip.
Yeah.
And then going into rhythmic gymnastics, which is the ball and the rhythm and all of that.
Wow, so you've done all that stuff.
I've done all of it, yeah.
And so, people could walk into your living room at home, see you waving ribbons and stuff.
Pretty much outside, used to practice in the garden.
Wow, but have you put that to bed now?
Yes.
So what do you do in place?
So now I'm a physically active person. I like being physically active and moving, and so I decided to do more weight training because that makes me a better chiro.
Yep.
And then doing yoga and sort of doing the other sort of side of it, which is yoga and Pilates type of based trainings. I like the combination because it just is good for my body.
South Africans, they typically love their running. Is that for you?
I'm not personally a runner, but I love to treat runners for some reason.
Good answer.
It's just come to me. And long distance runners were my kind of thing.
Cool.
But
Comrades Marathon.
Comrades Marathon.
Yeah, nice.
Yeah.
Comrades Marathon is a 90-kilometre double marathon race held in Natal, KwaZulu-Natal. That's you have an uphill from Durban to Pietermaritzburg and a downhill run Pietermaritzburg to Durban. Absolutely grueling run. And you've treated people. You've run the comrades.
I haven't, but they have, and I feel like I've run it for them as well.
Yeah, absolutely. Cool. Tell me, do you have any chiropractic inspired philosophies?
I wouldn't say I've got personally chiropractic philosophies, but I do believe in the general chiropractic philosophy that subluxation of the spine, or any extremity for that matter, will give the nervous system, will put the nervous system under strain and cause disease and dysfunction in the body. But I also do believe that there has to be a holistic approach to the body as well, and it's not just a spinal or extremity joint issue. It is usually a holistic approach, including muscle, ligaments, tendons, and I believe you have to address the combination of the two and have that as a part of the treatment in order for the person to get better. And I also do believe that treatment should be more longer sessions, and I believe that the patient needs that time so that we can assess the body correctly and properly, and be able to address both as well.
So just to rewind, you used the word subluxation. Subluxation, the medical definition is partial dislocation. I'm assuming that's not quite what you meant when you talk about subluxation, because it is a bit of it can be a polarizing word in chiropractic.
Yes. So just to clarify, it was more joint misalignments in the body, in layman's terms.
Okay, perfect. So Lauren, just quickly tell us, how long have you been working as a chiropractor?
Just over 8 years now as a chiropractor.
Okay, so you're fairly well set in your career as a chiropractor. What has working as a chiro taught you about life?
I just love to deal with people, different types of people. It's taught me to be more patient, and to deal with different personality types, and just the experience of dealing with people and how people work has really been inspiring to me.
I can attest to that. Yeah, it's definitely taught me a lot about working with people. And has affirmed my love for the different types of personalities that walk in here, and how to deal with a range of different people. Hi. So, Lauren, continuing with our interrogation of you, tell us from a chiropractic perspective, what are you good at?
I like a combination treatment, as I said before, and I really enjoy the muscular component. So I enjoy doing a bit of soft tissue, a little bit of needles. Dry needling is my thing.
I feel like needling is your thing.
Yes. I really enjoy needling. I know the benefits of needling by having needled people over many years now, and the chiropractic component, at the end, due to my size, doing a lot of soft tissue based work first has really been beneficial, and doing alignment based work at the end, and doing that combination effect really does make a difference to people.
And you do manual adjustments as well. You use your hands. I've been adjusted by you. Very impressed, obviously. Going back to your training in South Africa, I'm quite interested to hear about that. When we study in Australia, it's a 5-year course. We do a 3-year science degree followed by a 2-year master's. It's quite a grueling degree. It's difficult, I would say. By the sound of things, you were telling me before, yours is quite competitive and challenging as well. Can you quickly tell us how many years it is, and give us an idea of how difficult it is, and if it's easy or hard to get into?
So it is quite hard to get into. They specifically look for people that are academic and sports driven as well, so it's quite a niche type of person. It is a 6-year degree.
Oh, wow.
That is they sort of base it on degree honours masters, so it is a master's degree, and we do a research thesis or dissertation at the end, and it just depends on how quickly you want to finish. So some people end up being a little bit longer, but most of us finish within about a 6-year period.
Wow, that's very impressive.
Yeah.
Okay, Lauren, final question. Tell us about your working experience.
So I, straight out of university, I went and worked with another chiro, and I was there for about 4 years. I learned a lot from him, manual-based chiro, of course, and he did a lot of sports, the sports side of chiro as well. So I did pick up a lot of, that's where the runners came from, the love for treating runners.
Because there's so many runners in South Africa, hey? I mean, particularly because of Comrades Marathon, but I remember when I used to live there, Tuesday night for some reason stuck out in my head as being just runners everywhere on the streets. And you were in Joburg, I was in Durban, so runners everywhere.
Runners everywhere, yeah.
And you know, obviously cricket and rugby, hugely sporting population.
Yes.
So you got lots of experience treating sportsmen, working with that guy.
Yes, and then from there I decided to spread my wings, and I ended up doing a bit of a locum position with a lady on maternity leave. And then at the same time I started my own practice on the side, and with her permission, of course. And I grew my practice from there, and I had my own practice for 4 years in Johannesburg, South Africa.
Wow.
And gave it up
to come and start a new life in Australia.
Yeah.
Cool.
Yeah.
Awesome. Well, it really is wonderful to have you here, and I know that people who will have the privilege of being treated by you will be very happy with their results. I have no doubt about it.
Thank you, Tom.
Thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks, mate. Good on you.